Towards the middle of the documentary, we witness the smoking gun moment when Dan is confronting the physician running a pill mill in his community about a lethal opiate prescription written for a young patient. The tense altercation between Dan and the doctor ultimately ends with the physician questioning Dan's authority as a pharmacist. Healthcare is full of these difficult conversations, and we explored some of the ways that we can navigate these difficult conversations with healthcare professionals who may refuse interventions from pharmacists.
Physicians refusing intervention from pharmacists is one of the major factors limiting collaboration between pharmacists and other healthcare professionals. However, a way to navigate such difficult conversations would be in proper documentation. Medication therapy management and medication error report forms are possible ways of documenting such.
So let me touch on that first part of the question. I would say that opioid use is definitely at the early stage of the endemic ladder in Nigeria. And we have reported cases of its use by medical and non-medical professionals for non-medical use. And this has definitely been a threat. And like I said earlier, it's not exactly prioritized because there are more present endemic diseases, right? So opioid use is definitely on the rise, but it isn't at its peak just yet. It's still quite early.
I believe in always advocating for the patient first, and I think it's incredibly important to document the ways that we are advocating for our patients. There are some health professionals that are always going to reject pharmacist intervention, but we're still responsible for advocating for the patient and advocating for what's right for their medical care.
Where the professional, the physician, sometimes it's really hard because it's hard to really build these relationships with them. You know what you're talking about, and if you don't have that, we will empower patients to make informed decisions during their
and they don't really recognize our potential. So we were always advised by our seniors to support our intervention with evidences, and that